Let's talk about filriasis. I'm Dr. Nadeem Sajjad Raja. Here I show you a few pictures of this disease, which are taken from WHO and other websites. Filriasis is a disease caused by a chronic mosquito-borne parasitic infection. Chronic infection can lead to swelling of extremities, hydrocele, and testicular masses. It is the second largest cause of permanent deformity and disability behind leprosy worldwide. These patients are not only physically disabled but suffer mental, social, and financial losses, contributing to stigma and poverty. WHO declares it as a neglected disease. Several programs exist to eradicate filariasis by giving mass drug administration to population in endemic areas. It affects 120 million people in 72 countries worldwide, mostly in the tropics and subtropical areas of Asia, Africa, Western Pacific, South America, and Caribbean. 4 countries in America are endemic: Haiti, Dominican Republic, Ghana, and Brazil. 1/3 of children in endemic regions are asymptomatically infected with Wuchereria bancrofti. Half of the patients infected are in their 30s or 40s. Men's are more than affected than females. 882.5 million people in 42 countries received medication to control this disease. The global baseline estimate of people affected by lymphatic filariasis was 25 million men with hydrocele and over 15 million people with lymphedema. At least 36 million people remain with these chronic disease manifestations. Eliminating filariasis can prevent unnecessary suffering and contribute to reduction of poverty. What is the cause and transmission? This disease is caused by at least 3 species of nematode parasite, Wuchereria bancrofti, Brugia malayi, and Brugia timuri, and is transmitted to 5 genera of mosquitoes: Aedes, Anopheles, Culex, Mansonia, and Ochlorotatus. Humans are the primary host for this parasitic disease, and mosquitoes are the vector. The mosquito deposits larvae into the bloodstream. Larvae reaches to the lymph nodes and grow into adult worms. The larvae have a predilection to deposit in femoral lymph nodes. They undergo sexual reproduction, and female give birth to countless microfilari, which are dumped into circulation. Females can give off eggs for approximately 5 years, and male can live up to 9 years. The lymph nodes become occluded, which disrupts the lymphatic drainage and increases the susceptibility to repeated infections with streptococcus, fungus. This acute on chronic inflammation leads to fibrosis and remodeling of the lymphatics. Further perpetuation, contractile dysfunction, and leading to the dermal skin changes seen with elephantiasis. What are the common signs and symptoms? This disease can be asymptomatic, acute, and chronic infection. Majority of infections are asymptomatic but can lead to damage to the lymphatic system and the kidneys and alter body's immune system. Lymphedema, skin swelling, scrotal swelling, breast and genital organs involvement is common. Secondary bacterial infections are common. So how doctors can diagnose this infection? Peripheral smear, take peripheral smear, send to the reference lab, prepare 2 thick and thin peripheral blood smear samples, and then send for the identification of Wuchereria. Then PCR, that is the polymerase chain reaction, that detects the antigen of the causative agent. So that can be done. So first of all, the very important is the history and the examination. So mostly it is done on the clinical grounds, and then ultrasound and other tests are used to confirm your diagnosis. So how we can treat this infection? So please remember that the antibiotics or medication or antiparasitic medicine should be taken only on the advice of the specialist doctor. So diethyl carbamazine as a single agent is used, or a single combined dose of ivermectin, albendazole, and DEC resulted in clearance of microfilariae in 96% of affected patients for up to 3 years. And WHO, World Health Organization, also suggests this triple therapy, especially when there is no loa infection. So doxycycline is added if there is a loa infection. Surgical treatment is also advisable, like a debulking of skin and creating lymphatic anastomosis to improve the diagnosis. Thank you very much for watching this video.